Okay. So I'm going to share my screen and have
First off, we're going to go ahead and get started with a little bit of housekeeping
oh, okay.
before we get rolling. This is a part of a series of bill updates that the regional behavioral health coordinators are working on. Just because we're in the middle of session, there's been some updates to bill language, and we want to make sure that all of our stakeholders have the best information possible regarding some of these bills, what their current content includes, what their status is, etc. So without further ado, let's go ahead and first off, I'm going to go ahead and read this disclaimer. The purpose of this bill update webinar series is to provide information that will help stakeholders keep track of the progress, content, and any changes to active bills in the 83rd, 2025 session of the Nevada Legislature, which relate to behavioral health. The content presented here is for informational and educational purposes only. It is not the intention of the regional behavioral health coordinators, their home agencies, funders, nor respective regional behavioral health policy boards to persuade participants to take action or position on any bill included in these update series. So no, we are not trying to lobby here. This is just education. A little bit of housekeeping. This webinar is being recorded and will be posted to YouTube. I've included this link in the chat, so you have it for your reference if you want to go ahead and open it up in your browser. Please don't click away because we do want you to stay here if you can. Unless otherwise specified, go ahead and hold your questions or comments for the end of the presentation. We will have some time for Q&A. If you do speak during Q&A at the end, please remember to turn your microphone off after you're done speaking. If somehow you forget, because that happens, I'll go ahead and I do reserve the right to mute you just to make sure that we don't have too much cross speakers going on. Please keep all comments, questions, and discussion respectful. We are here just to provide information. We don't really want to get in political arguments. I do reserve the right to remove anyone engaging in any subjectively inappropriate or disrespectful activity during the meeting. I don't foresee that being an issue, but you never know. And with that, I'm going to go ahead and turn it over to Dorothy.
So do you see it, Val?
There we go. Now it's up.
Okay, just the first
Yep,
screen, right?
correct.
Okay. Hello, everyone. As I said, welcome to all of you, a small but meaningful group here. Good afternoon. My name is Dorothy Edwards, and I have the pleasure of serving as the Washoe Regional Behavioral Health Coordinator. And my thanks to Val for inviting me today to just give you a update on SB 47, which is the Washoe Region's Behavioral Health bill. And you see the title Study on Behavioral Health Insurance Parity in Nevada. So before you roll your eyes when you see the word study, just let me share with you what we're trying to do and why. The bulk of the presentation is more of an explanation, really, and justification on the why of the study. And I'm going to quickly move through the slides so we stay on time and I don't jam us up too close to Q&A. I am reading, so forgive me if I go back and forth. And I'm trying to figure out how to change. Okay. So part of my role is to serve, and a lot of you've heard this before, so I'll kind of just go through a little quickly, but is to serve as unofficial staff to the Behavioral Health Policy Board. Most of you know a little bit about the boards. This slide just outlines some of the facts. You'll remember that the policy boards were created in NRS 433, composed of 13 board members, a maximum, some less, one of which is a legislator. So in the past, we have been fortunate in Washoe County to have Senator Julia Ratty as our legislator, and then Assemblywoman Sarah Peters. Both of these remarkable women fought hard to move the dial on many behavioral health issues and have contributed their expertise and influence on our policy board bills. Assemblywoman, former Sarah Peters, has been our greatest champion and really subject matter expert for SB 47. And this presentation includes some of her slides as well. I really wish she could have been here to present it. She does a much better job and answers questions certainly better than me. So each policy board has the opportunity to provide a bill draft, as you probably learned, each legislative related to behavioral health. And we have all participated in this process, and I'm sure Val is shaking her head and smiling. We've mostly enjoyed legislative success. There's been times when her board, her region has passed and we haven't, and there's been times when we've all passed, and so we've all had some legislative success in each session. But the legislators and the public, they get to view firsthand the passion that these boards and regions have for behavioral health issues in their region. The boards have, these are a couple of high-level mandates, keeping a pulse on the behavioral health issues in their region, which differs obviously from region to region. But in Washoe, we've had one of our priorities for many years, 6 maybe, the crisis response system, which strives, again, just sort of high level, to divert those individuals who are experiencing a behavioral health crisis away from ERs and jails, which is, frankly, where they often go inappropriately, but somewhere where they can receive the right care for the right problem at the right time. It's our no wrong door approach. And too often, because of the disparity in both community and workforce resources, those experiencing a behavioral health crisis are sent to inappropriate locations or just don't receive care at all. We are happy that we opened our first crisis care center in Washoe County about 4 weeks ago. So this is just a list of our prior board bills. I'm not going to go through them. I will make sure that Val has a copy of this and will be accessible to you to just view at your leisure. So this slide's probably what I'm going to spend the most time on, or I suppose it's one of the more important slides. What are we trying to do with this? So what's parity? Parity, again, I'm sort of not getting in the weeds of a lot of these things, but parity is in healthcare refers to the principle that mental health and substance use disorder treatment should be covered by insurance on equal terms as physical health care. There's federal laws that deal with parity. And in our 2021 session, Assemblywoman Peters presented AB 181. This bill required parity data to be shared with the state and reviewed proactively by DOI, that would be the Division of Insurance, building on the federal law. We've struggled a bit with some of that mandate. SB 47 seeks to initiate a comprehensive study of insurance parity for behavioral health care and other medical care. What it aims to do is develop policy recommendations that address the unique behavioral health needs of that leaves many Nevadans without the care they need. We want to analyze metrics such as network adequacy, reimbursement rates, denial of coverage, emergency care utilization, to provide essential insights into how the current insurance policies are impacting access to care. What our hope is the findings will guide the development of tailored solutions that consider Nevada's unique challenge, including its rural and urban disparities, workforce shortages, which you'll hear me mention several times, and our limited insurer pool. The study will also evaluate compliance with the federal, and I'll only say this once, MAPIA, Mental Health Parity and Addiction Equity Act, identifying opportunities for Nevada to implement innovative policies that improve care, reduce costs, and enhance outcomes. In Nevada, we haven't looked at parity in a holistic review of the effects or lack thereof. So that's kind of the goal here. Before creating, and this was sort of my lobbying, if you will, when we first started, before we create another piece of legislation that feels punitive or isn't really followed at all, we really need to assess compliance with the Federal Mental Health Parity Act, identify the gaps in coverage, where we're falling through the cracks, workforce issue, economic impacts, and only then can we move forward. Now, I'm not going to spend a lot of time. There is a much longer presentation on the legislative website that you can refer to. We presented to the Senate Commerce and Labor in February 26th, I think it was. And Assemblywoman Peters gave a very detailed presentation, but there's a couple slides I just felt I wanted to include, and this just outlines some of the barriers to both financial and non-financial. So the next couple of slides, and you can see the non-financial, I want to draw your attention to health workforce, because I mentioned it a couple of times because there is a very direct nexus to parity or lack thereof in health workforce barriers. And then, of course, the financial barriers, many of you have probably heard: insurance coverage, underinsurance, income and wealth, or again, lack thereof. So these next couple of slides, I wanted to just introduce you to some scenarios that sort of illustrate the lack of parity within the system. Again, our presentation was longer. We actually had 4 slides where we got into a little bit deeper, but my goal today was just to sort of give you the mood of why and what we're hearing and what we heard as we voted to select parity again to focus on. So in this slide, we're introducing you to Sarah and Emily. I'm not going to read it, but we see that Sarah has a sprained shoulder, and the healthcare response is indeed much different, much quicker, and what we'd like to see for Emily, Emily was suffering from severe postpartum depression. And there is her healthcare response. And this is not an exaggeration, because again, many of us have heard very similar stories. There's a wait list. I keep calling, I just heard this actually last month from someone who called me and said, I can't get my daughter in for 3 months. And so what causes that? We don't have time to get into the weeds of that, but our study hopes to identify, expose, and address some of those barriers. So again, it was just to give you an idea. This is some of what has prompted our study. This slide is a tale of 2 prescriptions. Again, it introduces us to James and Robert. Both James and Robert have a need for medication to manage debilitating illnesses. James requires blood pressure medicine, and Robert needs antidepressant medicine. And again, the scenarios describe how each of them have a healthcare response, and again, a stark difference between the two. You look at that just for a few minutes. So what are the ultimate goals now? We know these are significant and very ambitious goals, but go big or go home. And so that's what our board is like. What do we want to do? What do we really hope would be the results of this study? So we want to improve reimbursement equity, streamline prior authorization, reduce administrative burdens for behavioral health providers. We know that's significant. We want to address systemic inequities, ensuring that behavioral health care is as accessible and covered as behavioral health care. So I always say, so someone with a broken arm should not get better treatment than someone with a broken heart. And that's, a little maudlin, but you get the idea. We want equality in those services. We want to expose the disparity. Again, we're not trying to be punitive. We're just trying to say, here's where we need to improve. Push for policies that strengthen the behavioral health workforce and provider reimbursement and reduce the barriers. We want to seek to address or hope, again, writing policies and identifying where our workforce shortages are by identifying some of those issues. We all know that without better pay and policy changes, mental health care will remain inaccessible and provider burnout will worsen. So the goal is not only to assess whether behavioral health coverage is on par with the medical services in Nevada, but identify and in most cases quantify barriers to coverage and workforce challenges. And so then the ultimate goal would be to inform meaningful policy changes. And those are very ambitious. So now I include this slide, and I wasn't going to. I've gone back and forth. We certainly did in our main presentation. Watching the time here. because we've spoken to our behavioral health workforce and providers, we hear the desire to work and hire in the field, but the frustration and the challenges in doing so. There is a direct nexus between parity and workforce. And during our presentation, we had several people speak eloquently in support of the bill about some of these very issues. We've had a lot of meetings with and the support of Be Here Nevada, which I don't know if all of you are familiar with, but they has as its focus behavior education, health education, retention, and expansion in our state. So um, we just felt that it was important to include this one, and I'll let you again read that at your leisure. So why does it matter? Well, that's probably a given, but the federal law addresses parity and equity between mental health and physical health services. There's been iterations of it. There's been improvements that, and our own Senator Cortez Masto has worked on the legislation, but there continues to be gaps, and gaps in Nevada, probably other states as well. And we've touched on that. There still exist disparities in reimbursement denial rates, authorization requirements, provider networks. Ultimately, the economic burden is carried by the state, by the community, by you and I, and the community of untreated behavioral health conditions. So the key components, it would be designed to be conducted in several phases. There's data collection now being done, and I don't want to take away from that. It's not as if people sat on their hands, people that were mandated to do it by different entities, DOI, PEP, DHHS, Medicaid, to name a few. And we have met with all of them and gained some great discussion and support. The bill provides the DOI the ability to require additional data that may fill the gaps that we have now. And then with the help of an outside partner, which is going to be critical, such as the Gwynn Center, provide data analysis, not only to measure how we're doing internally, but also for comparison to other states. So the goal is to get a level playing field and to be representative of Nevada as a whole. And I should insert, I may say it in a few minutes, but we have already spoken to the Gwynn Center. They're super interested in that, and having sort of an outside entity provides it's a more objective study, we feel, but everyone has signed on to help us gather that. So how are we going to accomplish it? The goal, I use that word a lot too, is to secure funding with a partner. We've talked about Gwynn Center, but there are other potentials that we've checked with, and contract with expert researchers such as that. We have met with DOI several times to discuss these elements. If you are a follower of the bills, you will have seen the fiscal note that DOI felt compelled and discussed with us to insert. It is currently the only fiscal note. We have had good discussions and feel we're going to be able to address that fiscal note as we move to finance, understanding their limitations, like so many, to have resources, a grant specialist to apply for grants that would fund the rest of what would be involved for a study of this. So without getting into details that we haven't really thoroughly hashed out, but I want you to stay tuned because we will have those certainly by the time we pass the floor and get into finance, working on it now. So, and then you'll see the reason that we want to report annually, which I really like, and I know my other coordinators believe strongly in this too, is ensure that the data is analyzed regularly as we get it. Our goal is not to give legislators and policymakers 3 years worth of data and say, well, here it is, now let's solve it. So really an annual report has merit. It allows policymakers to look at things as they come in. So that was the reason that was added. So conclusion and next steps. We feel that requiring a comprehensive study, that AB 47 will provide the data that will inform us what is needed, We can't fix what we haven't measured, what we don't know. We don't know what we don't know. And before we lay blame and point fingers, it's time to work together, admit that there are things that we need to know and see where we're at. Where are the gaps? We need accurate data and not guesswork before we propose yet another, legislative action that doesn't get followed or isn't meaningful. So that really is my passionate plea. I would tell you that yesterday SB 47 was passed unanimously in the Senate Commerce and Labor. So now, like many bills, we go to the floor and then on to finance, which I always, I'm glad for our subject matter expert, Assemblywoman Peters. I do want to end with this quote because it is so important to me. Most of it came from NAMI, but many are disabled by severe and persistent behavioral health problems. Lack of parity is unacceptable. As a nation, a state, a community, we must invest in treatment and recovery and equity and services. We cannot go back to a system that discriminates against people with mental health and substance use conditions. And again, as Val said, this is not a lobby or anything. This just demonstrates the passion that we all have for equity for all. This last slide just gives you the leadership. I had mentioned that our previous legislators and our current legislator, who was just appointed, is Senator Angie Taylor, and we're thrilled with that and look forward to her becoming more engaged once the current session is over. So kind of a high level overview, but I think I left 5 or 6 minutes for questions if you have any. I may not be able to answer all of them, but would certainly get back to you if I'm not able. So I am going to stop sharing.
All right, everyone. Thank you so much, Dorothy. That was fantastic. If anyone has any questions, you can either drop it into the chat or you can use the Q&A box, which is at the bottom. If you do not see Q&A, there's a circle with 3 dots. You can click on that and Q&A will come up as an option. Or you can just raise your hand and we'll go ahead and get you unmuted so that you can ask your question. While you guys are thinking about that, Dorothy, if someone is interested in submitting an opinion on this bill, one way or the other, how could they do so?
Good question, and thank you for that. You may submit written testimony in support. I can provide that to Val. If you go to the legislative website, Nevada Legislature, you can click on Nellis. It's a pretty user-friendly website. It will show you how to send that letter of support, but an even easier way, email me. I'll send you all the information you need to know. You can write that letter, send the letter to me. If you don't want to write that, you feel passionate enough to show up or call when we go to finance, it will be a different presentation because the presentation is limited then to the fiscal piece, but it is an open meeting. And so you do get the opportunity to speak. So those are two. If the bill passes and you're further interested, like, well, how can I help? What can I do? Can I be on a committee? Keep in touch with me and I'll connect you with our boards, attend our policy board meetings, because certainly there will be more steps, more action steps to take once we get the bill passed and start planning what's the study look like. So several different ways that you can help. And the easiest is to shoot me an email. I'm good about responding.
All right, so we do have one question from Robin in the Q&A. Robin asks, how might the community and advocates help get this bill passed? What is the most effective strategy you'd like to see right now based on your feeling about how this will be received if we have a network of people who are in support? Thanks, Robin.
And thanks, you stole my thunder because I think I just kind of said that really. And we had asked Assemblywoman Peters too, how do we people want to advocate it? And again, trying to stay clearly neutral and not come across as a lobbyist. But those of you that have an interest and a passion, and I believe, Robin, we chatted a little bit via email, stay involved really on anything that we have a passion about. And if ever there was a time where we need citizen action, it's now. But reach out, attend the board or the board meetings, certainly the hearings as you can. They are recorded. You can send anyone are the chairs of the committees. So again, those are listed, Commerce and Labor. That's where we went rather than Health and Human Services Committee. Finance, Governor, your assembly and senator representatives in your community. That's the advice really for almost any piece of action, keeping your voice out there. But again, please feel free to reach out to me with any other information you have. I will ensure it gets to that. So if you just say, I just want to write it, you send it to me and I will make sure it gets out there widely. I hope that answered your question.
Sounds like it did. And I'm going to pop some advocacy tools that I threw together into the chat as well.
Nice.
So there's let me see if I can find this, if it's even coming up.
Did that include some of the addresses?
Um, so what I've got is I've been putting together, all right, let's share all of these. Cancel. Um, so there's some different opportunities. So for the first document I'm going to share is the NPHA Advocacy Toolkit. Oh, it's not going to let anyone with the sharing to do. Okay. Well, it's not letting me share this, but if you have an email from me, there's a link tree in my email signature, and that will take you to various different resources, including an advocacy toolkit. The main document in there is a toolkit built by the Nevada Public Health Association for professionals and advocates alike as to how one can engage in education and advocacy. And then other things in that toolkit include like, hey, here's some tips for putting together public comment and how to prepare that, and how to write an op-ed from a SAMHSA toolkit and that sort of thing. So there's different options, as Dorothy mentioned as well. Any other questions before we call it a day? All right, hearing none. Any parting thoughts, Dorothy?
No, just thank you so much for signing on, caring enough to take a lunch hour and listen to these. And thanks for Val. She does give the credit for putting these together. We've had huge attendees, we've had smaller, but it just speaks to, our passion for behavior health in all things. And that's not a lobby, that's just a fact.
Well, thank you again, Dorothy, for joining us. And thank you for all of your expertise. And again, if anybody is interested in getting more information, please reach out to Dorothy or I, and we can help you along. So have a great day, everyone.
Bye-bye.